Hi, today I'll be demonstrating how to assess the patient of signs and symptoms of dehydration before a surgery. So it is important to check on patients whether they are hydrated enough before the surgery to avoid any complications during the surgery. So the few things of dehydration signs and symptoms are such that patient has low fluid intake, which causes dry skin, dry mouth and lips with a strong odor, and weight loss. Other signs include dry eyes and drowsiness, as well as output of dark urine. So now I'm going to demonstrate a situation whereby I will approach a patient in which I'll be using my flush doll. So now the patient is in a semi-flawless position in which I'll approach the patient and ask the patient whether the patient is hydrated and assess for signs of dehydration. So first I will assess the patient's skin by checking on his hands and arms. So if the patient is dehydrated, the skin will feel clammy and it will feel a bit rough and dry, and that shows sign that the patient is not taking enough fluid. So the next thing I will check is the patient's facial, so the mouth, the lips and the eyes. So if a patient is hydrated, the mouth and lips will not be dry and the eyes will not be watery. So if there is signs that the eyes is watery, it shows that the eye is dry and lacrimal sacs is producing tears to hydrate the eyes. So last but not least, I will ask the patient whether the patient is feeling dizzy or drowsy. If the patient is feeling a bit dizzy and confused, that means the patient is not having enough water and the patient is feeling unconscious. That patient needs to take in more fluid. So that is how to assess a patient of dehydration signs. Thank you.